COVID-19. Today, we are doing this, as Mr. Mohale has indicated, myself and him, but other colleagues are in different places. Myself and Mr. Mohale are speaking to you from the Diamond City of Kimberley, the capital of the Northern Cape, where later on today, just around 10 o'clock, I will join the Premier of the province, Dr. Zamane Soul, and also Minister of Sports, Arts and Culture, Minister Mtetwa, on the Return to Play national program, which I'll say a little bit more about later on. Due to the activities of these days, therefore, we have a slightly shortened program, media briefing this morning. We're pleased to report again that the number of new infections, as we mentioned, as we did so last week, that the number of new infections have continued to be on a downward trend over the last 7 days, with at least a 28% reduction in new infections and a 3.5% reduction in hospitalization. But we still have just over 5,000 people in hospitals with COVID-19. So again, just a reminder that the virus is still very large around us. The positivity rate has also reduced over the last 7 days, coming at an average of 2.7%, which again is the right direction. I emphasize that we're talking about 7 days averages because sometimes just following on various media platforms, people get concerned with the daily fluctuations of the numbers, especially sometime on weekends, Saturday and Sunday numbers are generally low. And then during the midweek, because there's more testing, the numbers rise. But what we look at is the 7-day average, but also largely also what informs us of the direction is the positivity rate over the period. Reported deaths are also down by 16%, which is also very good, although ultimately all of us are looking forward to a day when there will be 0 death from this virus. It will take us a little bit longer to see lower numbers of people still in hospitals, because even as the numbers go down, there are people who remain in hospital over long periods, and we believe that possibly over 2 weeks period, that's when you will also see fewer people in hospitals and in ICUs. But as less people get admitted to hospital, even the admissions and in the hospitals will start to reduce significantly. The vaccination program remains very stable, having kept the momentum since the previous week after the Vuma weekend. The total doses administered per day have remained at around 200,000 per day, although some days have been just a little bit below 200,000, but on other days, just over 200,000. On Wednesday, we're just below 200,000 at a figure of around 190,000. But for instance, yesterday, Thursday, the 14th, we're at 215,438. The total doses administered by yesterday were just a little bit below 20 million at 19.899, just around 19.9 million. So by the end of today, we will cross the figure of 20 million mark of doses of vaccines administered since we started with this program, with the Sisonke program, on the 17th of February this year. Individuals with at least one jab have reached now 13.8 million, which is just over 34.6% of all adults. So we're getting closer to 35% of adults with at least one dose of vaccination, which will be significant in that when we reach 35%, it will mean we're at half of the 70%, which is the percentage coverage which we are targeting. The performance of provinces differ quite a bit, with the Western Cape having surpassed the other provinces in terms of percentage coverage, having passed just over 40% of the population, standing as of yesterday just over 43%. And the Eastern Cape, Limpopo, and Free State coming very closely by next to the Western Cape, approaching very, very close to 40%. All three are at 39 plus percentage, so just a fraction of a percentage below 40. All three of them should cross the 40% coverage before next week, Monday. The Gauteng province, which is our most populous province, is pulling fairly well, with over 3.5 million doses already administered. But due to a large population, that only accounts for 31.7% of the adult population. I emphasize the number of individuals vaccinated because Gauteng, as you would be aware, is almost a quarter of the South African population at this stage. On the bottom half, we are concerned by the pace of Mpumalanga province and KwaZulu-Natal, especially with KwaZulu-Natal because it's got a big population, and therefore when the coverage is not moving up like the others, it does affect also the national average. So we'll be working with the two provinces as we work with all provinces to make sure that we can assist when necessary to make sure that their coverage can also improve. We are pleased with the enthusiasm with which South Africans have embraced the vaccination certificate. As of 15:30 yesterday, the 14th of October, more than 1.5 million certificates had been downloaded. We have also resent more than 10 million SMSs with vaccination codes in case some of the people who have been vaccinated had not saved their SMSs and therefore were unable to locate their vaccination code. So over 10 million SMSs have been sent since the vaccination certificate was launched to assist those who might have not saved their vaccination certificates. We acknowledge that many people were frustrated when the system was not responding or very slow. This was largely due to big numbers at the peak demand times when the server of the system could not cope with all the demands for downloading of the vaccination certificates. So at this stage, this matter is being attended to. The certificate development team at the CSIR is monitoring the traffic and making appropriate adjustments. Our topmost priority at all times is to protect your personal information. So we apologize for the inconvenience to those who had to try many times, especially those who had the pressure to use the certificate urgently. We are certain that the service will only get better and improve on a daily basis. So we expect this to not to be a long-lasting problem in terms of the server being overloaded with the demand. As we said also last week, this is just the first phase of this vaccination certificates, and we are pleased with the lessons we have learned over the week and the fact that over 1.5 million people were able to benefit from accessing the certificate. We are quite confident that by the end of October, there will be more improvements in terms of access to the vaccination certificate and also in terms of the security of the certificate. Please continue to save your vaccination codes as you get the SMS after vaccination. In case you get into trouble, you can use the hotline, which we did advertise last week, but I will repeat the number again, which is 0800 029 999. I repeat, 0800 029 999. Or else you can also email evds@health.gov.za and seek help through those means. We welcome the partnership with the Ministry of Sports, Arts and Culture in promoting a safe return to sport through Return to Play program, which I've mentioned earlier on, that I'm here in Kimberley and will be joining the Premier and the Minister Mthethwa in continue to roll out this Return to Play program. We are happy that one of the leading sports codes with with a big mass following, as we know that football or soccer is one of the sports with a big mass following, that the Federation of Football has led the way with the safe admission of spectators, 2,000 spectators as per the current allowance of outdoor gatherings. On Tuesday evening, 2,000 spectators were admitted to the FNB Stadium for the match between South Africa and Ethiopia, and all those fans who were admitted had to have a ticket to enter the stadium, but also had to show their vaccination certificates. So indeed, we welcome this collaboration. We know that other sports codes are also waiting to launch this, to also benefit from the limited spectators for those who are vaccinated. We know that the sport of rugby has already indicated their eagerness also to follow in this direction. So we want to thank Minister of Sports, Arts and Culture, Minister Mthethwa, and also Deputy President Mabuza for being the champions of this campaign. I'm confident that once we can be assured that the protocols to manage spectators are in place, working together with the Ministry of Sports, Arts and Culture, with the permission of the Coronavirus Council and the Cabinet, we can be able to ramp up the numbers very safely to attend these sports activities. We encourage all sports, arts, culture, music, exhibitions, and conferencing to follow suit. So the message is vaccinate, and so that we can be able to open up more activities. And we're happy that this is already happening on the ground. We're looking forward to many more activities where people who are vaccinated can return safely to these activities. Today, I'm happy to also to announce that we have reached a stage where we are ready to open up vaccination for children between the ages of 12 and 17. This is the secondary school cohort. We are now ready to start vaccinations for this group, the young people from the age of 12 to 17 years. Now, this follows a recommendation which we received from our Ministerial Advisory Committee on Vaccination. This recommendation was also supported by health MECs when we met on Tuesday afternoon on our statutory National Health Council, and this was also supported by Cabinet the following day. This service will start on the 20th of October to allow the necessary preparation on the EVDS registration system and also other logistical preparations. We believe that this will come handy as schools start their examinations, or some of them are already advanced towards concluding their academic year and are starting to prepare for the next academic year of 2022. The Fisa Vaccine, which has been approved by SAPRA for this age group, will be used for the purpose of this vaccination of the young people 12 to 17. The Vaccine Ministerial Advisory Committee advised that for now, we should only give one dose of Pfizer, while assessing information which suggests that in few cases all over the world, there has been some short-lived cases of transient myocarditis after the second dose. Now, this rare finding of this adverse effect, it's a slight inflammation on the heart muscle, which has been noticed in a few cases And the vaccine MEC has advised that while this is being monitored all over the world, at this stage, there's been no indication that the first dose has any serious side effects. So for now, it will be just one dose while the studies are continuing, which we believe that will still offer significant protection. And once more information comes, then we can space the second dose for the young people. The timing of the second dose, therefore, will be informed by further information as this rarely observed side effect as we get more information. But we can assure parents and the young people that even where this has been noticed, it has had no permanent risk. So we're just taking precaution in this case. The Vaccine Ministerial Advisory Committee has also advised us that additional doses should be given to individuals with compromised immunity, such as those who are on long-term oral steroid therapy for autoimmune conditions, and also those who are also on various treatments for hematological or immune malignancies. Those also with solid organ or bone marrow transplant, those on renal dialysis, and also those with primary immunological disorders. The advice is that these categories of patients be offered an additional dose of the prescribed normal doses of the vaccine on which they would have received. In other words, if a person of this category has received the one dose J&J, the advice is that they should be given an additional dose of the same vaccine. If they've received the 2-dose Pfizer vaccine, they should be given a third dose so that they can be able to reinforce their immunity. Now, this should happen strictly under a referral by a medical practitioner and under the supervision of such medical practitioner. The other matter which you are addressing is that of the call by various health workers on the front line that they should be considered for booster doses due to the high risk of their work on the front line, and that they were the first to receive vaccination almost 8 months ago, starting on the 17th of July, 2021, under the Sibongiseni study. The request is receiving attention, and we are working with the South African Medical Research Council on a possible approach to this, and the MRC has already applied to SABRA for permission to consider a J&J booster to allow the Sibongiseni study in order to use this to do a second Sibongiseni study so that they can be able to study the benefits of improved immunity with a booster of the J&J vaccine. Sorry. And lastly, there is also the issue of people who have come to South Africa having received a vaccine which is not being used in the country. These are either foreign nationals who reside in South Africa and had gone to their countries and received a single dose vaccine of, for example, AstraZeneca or Moderna or Sputnik or Sinovac and various other vaccines which are not yet in use here in South Africa. We are not able to provide the second doses where they are required, and neither can we give these individuals the vaccine certificates which they need for various purposes. The advice which we have received is that these individuals can be offered one dose of the Pfizer vaccine to complete their 2 doses, as there is adequate evidence, for instance, that the AstraZeneca and Moderna vaccines work very well if combined with the second dose of Pfizer. So there is indication and information that this is safe. So we encourage those individuals to come forward. Many of them have approached our vaccination sites and we didn't have answers, but at least we do have an advice now that we can safely use the Pfizer vaccine. So they must keep the record of the vaccination which they had before, because our system will only be able to issue them with a vaccination certificate for the second dose of Pfizer, which would have been administered in South Africa. So they will need their previous record to show that they've actually received 2 vaccine doses. We are again calling on all South Africans to come forward and contribute towards their own health safety and that of their families, friends, co-workers, by coming forward to vaccinate. By doing so, as we have seen already with the return to play, on Tuesday night with the soccer team, it's quite clear that if many of us vaccinate and we get closer to the 70% of the adult population, we can reclaim our lives, and we can be able to get into many more activities and make sure that South Africa can again be fully open, not only for business, but for various social activities. Thank you very much for watching and listening. I give you back to Mr. Foster Mohale. Thank you.
Thanks, Honorable Minister. I think there's an echo. Can you hear an echo on your side, Minister?
Yeah, it's bad, I'm afraid. Okay, thank you.
Let me kill one. The network is terribly bad on my side.
You are better now, you can proceed. Yes.
Yes. Yeah, so far I've got a few questions directed to Minister and other colleagues who can assist in responding. Yeah, the first question is related to the vaccination of children. It reads as follows: will the vaccination of children or people between the age of 12 and 17 take place at school? As the Minister has already indicated that the majority of this cohort are still at high school, so while few still in primary school. So will the vaccination of this cohort take place at schools or at the normal vaccination size, the public and private? The second one, someone who said, I vaccinated, but according to the EVDS, there are no records that indeed I vaccinated. So how do I go about addressing this issue? The third question is related to the audience, the 2,000 audience, as we've seen during the week, that about 2,000 fans have managed to attend, vaccinated fans, not just fans, managed to attend the game between South Africa, Bafana and Ethiopia. So are there any plans to increase this number if the number of people increase, as we always encourage them to do that? I see another question is from Christian Duplessis from News 24. He says, from when can the 12 to 17 years old register on the EVDS? Even though I think Minister has touched on this, but the colleagues can assist to elaborate on this question. So I'm going to allow the Minister and Deputy Minister and Dr. Crisp and other colleagues to respond to these questions while we are waiting for more batch of questions. Over to you, Minister.
Thank you very much. I'll deal just with one question, and then I'll ask the team, Dr. Crisp and the team, and Deputy Minister will also indicate where he wants to come in. I'll just deal with the issue of return to play. That indeed, in our plans from the NCCC and Cabinet, we are quite committed that there should be a return to open life. So that's why the return to play, the safe return to play program is running. And as I said, I'll be joining that at 10 o'clock today here in Kimberley. So the 2,000 fans is really just introduction and testing the systems, the safety measures, making sure that we can work on this, issuing of vaccination certificates, together with the tickets for the matches, and also at the venues, making sure that there are no congestions, there's no congestion, the queues are managed, all the protocols in terms of distancing, sanitizing, and all those. Once we are satisfied that the sports organizers are now very, very much in tune in terms of managing this activity safely, we will be, together with the Minister Mtetwa, we will make a recommendation to the NCCC and to Cabinet so that more numbers can be approved. We're looking at if everything stays stable and we get used to this, not in a very long time, we could go as high as maybe 10% of the stadium, 15%, 20%. And finally, as we go on and if things remain stable and safe, we can go up to 50% of the venues. But we want to do this steadily and very cautiously and safely. So we want to assure members of the public that indeed the plan is to improve, to increase the numbers of people who can attend various activities, especially when they are outdoors. I'll ask the acting DG and the team to respond to the others in terms of whether vaccination will be at schools, records which could not be found, and also I'm trying to remember the last one. It was also about 12 to 17 years old. I'm sure the team have noted. Over to you, acting DG.
Morning, thank you very much, Minister, and morning to Deputy Minister and to the viewers, my colleagues. So the question about vaccination of children at school, no, we are not running the vaccination program for children at school. At the moment, that would be too much to organize, and there are other arrangements between the Department of Health, the Department of Basic Education, and school governing bodies that would have to be complied with. So we will look to that for next year. But for this period, this rollout of the national vaccination program, children can be vaccinated at all public and private vaccination sites, just the same as everybody else. In terms of when we are intending to begin, at this stage, there are a number of changes that need to be made on the EVDS system to allow that age cohort to be vaccinated and to change the consent form to allow for children's consent, including the notification of any different side effects that may be available or may be seen for children, such as the Minister indicated, and that's going to happen over the weekend and be tested on Monday, Tuesday. It's our intention for children to be vaccinated from Wednesday next week. That's the 20th. That should give a few days for those that are writing matric to be vaccinated and have a couple of days to get over any mild side effects that they may experience. As far as no records on the EVDS system is concerned, there are two main reasons why we have been seeing this. The first one is that when the vaccination took place, it was recorded on a paper record, which has not been captured on the system. And the second one is that there were a number of bulk registration programs, both in workplaces and in the public essential program service, that were wrong telephone numbers were used or bulk telephone numbers were used, and it's not been possible to trace back to those people. So there is a team that is following up on each one, and the Minister has given the helpline number and the email address, and the team will then follow up on each person's challenges, because they'll be slightly different from one to the other. And I can allow Ms. Wolmerans to add if she wishes on that one, because it's her team's responsibility to chase these. Thank you, Minister.
Melanie, you are mute. Please unmute.
Apologies for that. Good morning, Minister, Deputy Minister, colleagues, and all the viewers. Dr. Crisp is correct. You can please send an email to evdsqueries@health.gov.za. We've got a team of people that is assisting. You can also attempt to go back to the vaccination site and also asked that if it is possibly that there are a form that hasn't been captured, that they capture the form. And then once the electronic record is on the EVDS, you will be able to download your vaccination certificate. And also with regards to the children, the registration on the EVDS will be as from the Wednesday, the 20th, and on the same day, vaccination can also start. Thank you.
Thanks, Minister and Dr. Chris and Milani for answering this first set of questions. I have got the second set of questions which read as follows. Will the parents have to give a consent to the teens before they can vaccinate it, or do they have to go and register on their own? I think this one is partly answered, but we can elaborate on it. The second question is what is the time frame for making decision on booster shot for healthcare workers? The time frame for making decision on booster for healthcare workers. The third one is what is the percentage of people who have received the first dose but they've not received the second dose? And what also want to check if are these people in majority adhering to the time interval that we've given, that 42 days or 6 weeks? And what are the plans for the government or the department to encourage people who have received the first dose to come forward for the second dose? The fourth question is what is the estimated population of 12 to 17 age group? I mean the ones that we just announced. What is the estimated population for this cohort that we're going to start vaccinating in the next few days? The last question is that it has been reported in one of the media house that about 8,000 healthcare workers in the Western Cape have not vaccinated. So is the department concerned about this, and is there any plans to impose or ensure or introduce mandatory vaccination, especially for healthcare workers? I'm going to allow the minister and colleagues to respond to this question.
Thank you very much.
While I'm waiting for the third batch of questions. Over to you.
Thank you very much, Foster. I will only take the last one of the 8,000 healthcare workers who have not been vaccinated, as reported. Indeed, we never reached 100% coverage of the healthcare workers. I'll ask Acting DG and Melanie maybe just to give the correct figure. I know it's upwards of 80%. I think somewhere around 85% to 87% of health workers who have been vaccinated. So it wouldn't be a surprise. It's not a surprise to us if there's a talk of 8,000 because we never reached 90%. So now the question as to whether with this experience, are we considering making vaccination mandatory for health workers? At this stage, the answer is no. We still, as a government, want to pursue approach of persuasion, convincing people about the safety. As to whether at some stage this may change, this will be monitored. We are also looking at the various, constitutional provision. Many people will be aware that a number of legal experts have actually been saying that it will not be unconstitutional, but we want to look at this very carefully, and therefore at this stage, the government's approach remains that of persuading even health workers to come forward for their own protection and the protection of their colleagues. So we'll continue on this mission of speaking to those health workers and trying to convince them to take the vaccination. So we're not considering a mandatory at this stage. I'll ask the team to deal with the others about the parents' concern, the time frame for the health workers boosters, and also the challenges about first and second dose where people are not coming forward. I hope I'll ask the acting DG to lead in that, and maybe some of those may be shared with other colleagues.
Thank you, Minister. So let me first of all comment, just add to what the Minister said about healthcare workers. In the public sector, obviously, because we know the denominator, the total number of employees in the public sector, it's possible to measure quite accurately the percentage who have been covered. And the definition of a healthcare worker in the public sector is everybody. So that's not just those who are registered as health professions. It includes the security staff, the porters, everybody who supports the health system. And I'm going to ask Melanie if she's got a figure readily available on that. In the broader healthcare space with the private sector, it's much more difficult because the definition was expanded to include a very wide range of people who work in the health sector but are not necessarily directly health professionals. And we have less indication of what that denominator is. So it's a little bit more difficult to comment on the percentage that have been reached. In terms of consent for children, so the Children's Act makes provision for children from the age of 12 to 17, in other words, not yet adults, to give their own consent for medical treatment. And there are provisions within the subclauses of the Children's Act that explain which children can give consent for what. So children do not need their parents' consent generally for any medical treatment, and there are specific guidelines on that. But parents can give consent for their children to get vaccinated. So it is possible for a child to go between the age of 12 and 17 to go for vaccination at a health service without their parents' consent. That's another reason why the school health program is not being used at this stage, because there's an agreement, a multi-party agreement between health and education and school governing bodies around how consent is given and how they are vaccinated in the school health program. And as I said, that's something we will deal with in a long and ongoing process later. In terms of the population, this cohort of 12 to 17 million is around about 6 million children between those age groups, and it would be good to get hold of at least half of those children before the school holidays and the end of exams. The timeline for healthcare workers boosters depends very much on the approval process. Now, it's at quite an advanced stage. The Department of Health does not get involved in the approval of anything that happens in the regulator for very obvious reasons. But we are informed by the applicants for the research into the Johnson & Johnson study and in our normal daily reporting that we get from SAPRA of activities that they are at an advanced stage. So it may be a matter of days or a week, but as soon as we do know what has, that has been approved, that will also go into the public space. So it's not a long time frame, but we're not going to give an exact time frame. So I'm not sure if Melanie is able to answer that other question now about the percentage and the percentage of second doses. She may have that data available. Thank you.
Thank you, Dr. Crisp. With regards to the public sector healthcare workers, so it's those that is working for the public sector and has got a partial number. That's how we identify it. The total number is 395,969, and 304,504 has been vaccinated. That's a total of 77% of healthcare workers or employees of the health sector in the public sector. That's the figure. With regards to second dose vaccinations, we are monitoring that. There is, if we look at the totals in terms of people coming for their second dose, we are seeing that there's a pattern often that goes with the end of the month, and we assume it's when people are coming in to do business in town, and it's related to activities the end of the month and the beginning of the month. So there are often where people are coming 2 weeks after the 6 weeks, so coming at 8 weeks, and some of them also coming at 10 weeks for their vaccination. This, however, is still within the clinical protocols. With regards, so we're monitoring the second dose vaccinations, and there's a very low percentage. I think I can't remember the exact number now. We maybe can provide it at some stage. A very low percentage of individuals that has not come for their second dose within 120 days after they received their first vaccination dose. We are also now sending regular reminders to individuals to come for their second dose vaccination, and also structuring the communication program to remind people to come for their second dose vaccination. Thank you.
Thanks, colleagues, Honorable Minister Milani and Dr. Chris. I've got the last batch of questions which read as follows. Someone says, I've lost my ID, but I know my ID number. Can I register to vaccinate? I think this one Milani will be able to address on this one. The other issue, the other question is, can the department provide vaccination verification support to other sectors like they did with the Bafana, for in case if the political party wants to have a rally, they need only those who are vaccinated. Can they support? Can they provide this verification process to other sectors of the society? The other question is any update on the vaccination of undocumented citizens, undocumented and homeless citizens who don't have the required documents to register and vaccinate. The other question is, will the booster be only J&J or Pfizer? Or if, for example, if you've been vaccinated with J&J, is it a must that your booster needs to be another J&J, or can they mix the vaccines? The last question is, why is the booster only talking about healthcare workers, not the general public, because they've received the same type of vaccine? Over to you, Minister.
Thank you very much. First, I'll start at the bottom and ask the team to deal with the more difficult ones. Why is the booster only for, at this stage, being spoken about being for health workers? This is because overall, from the scientific advices, there hasn't been any clear proof that adding booster doses is essential in terms of the immune system at this stage. That's why even with the health workers, what is being envisaged and under the auspices of the Medical Research Council is a booster, but at the same time, which will also be a part of researching the impact of the extra vaccination, where the original approval has been that this vaccine can be used, for instance, J&J as a single dose or Pfizer as 2 doses. What will be the impact? There's, at this stage, various patchy information. You also, if you peruse literature from different medical scientists, I know that people may ask, but in some countries already, they're already implementing this, I think, well publicized, for instance, Israel, and I think a few other countries are starting to talk about that. This is, the fact of the matter is that the reason why the World Health Organization has said that advised countries to go slowly on this approach is because the evidence is still very sketchy in this regard. So until such time that the more information is available in terms of what is the length of the protection on a normal vaccination as approved, and what will be the additional benefit of a booster vaccination, until such time that this is very clear and available, we will not be considering general, additional doses for the public. So that's really the reason why at this stage, the only consideration is for those who are immune compromised due to the conditions which I've mentioned, which will happen under supervision of their medical practitioners. So it will be like a prescription referral by the medical practitioner to say this person has this condition and therefore needs a booster vaccination, or else it will be as part of this envisaged Sisonke 2 to look at the impact of a booster vaccination. So let me leave it there and give back to DG, Acting DG and the team.
Thank you, Minister. So I'll also mention about mixing vaccines. So besides what the Minister says, there are also other studies. Some have been done in other countries, and there's a study that is planned here in South Africa as well, looking at combining vaccines. So using the vaccines, Ad26 vaccine, and using an mRNA as a booster. And there are studies that have, relatively small numbers from around the world. And we are getting advice on some of the outcomes of those studies. But there's also a study here and elsewhere that is looking at fractionated doses of mRNA vaccine after for instance, the J&J. And that would help us with the costs going forward. In other words, using not necessarily a whole dose, but a half or a quarter dose of the Pfizer vaccine after J&J. So while those things are going on, and we're not at a 6-month period on the vaccination of the general population yet, we have some time to observe and wait to take our decisions. We also only on 35% of the adult population having got a dose or thereabouts, as the Minister announced earlier. So it's still early days, and we need to get more people, more individuals vaccinated before we really start worrying about booster doses. So for a combination of reasons, we are not under huge pressure at the moment to make decisions around booster doses, except for the health workers who started vaccinating on the 17th of February. And so that is 8 months ago, and that has been adequately explained. Melanie can add details, but I can indicate that the vaccination of undocumented migrants, the solution was developed. There are a number of pilot projects that are running at the moment. Now, there are issues around the piloting of the actual solution, in other words, the issuing of an ID by the health department rather than Home Affairs Department on our system, on our vaccination system. But there are also issues about where to vaccinate. So the actual vaccination program on the ground, and there are selected sites and not just all sites in the public and the private sector. But that is running at the moment in a number of provinces, and we've already seen some learning that will go into the more widespread rollout of vaccination of undocumented people. And I want to emphasize, undocumented are not all non-South Africans. There are many citizens who are of South Africa who are undocumented as well. So it's a mixed bag, and it's quite different from one part of the country to the next. I'm sure that Melanie can add on vaccination verification support. We are not geared as the Department of Health at the moment to offer widespread support. We have been doing these pilots, as the Minister indicated earlier. There's a specific program running between the Department of Sports, Arts and Culture, which includes looking at how the system, the verification works. From the end of this month, when the verification is done automatically on the QR code, should be a straightforward process. But while we are still in this transition and we haven't issued the technology for reading the QR codes, there's a different process we are using. It's a little bit more intensive, and we don't really have the capacity to handle many events at the same time. But Melanie might want to add to that one. And I'll leave the question of the lost ID to her because she's dealing with this almost every day. Thank you.
Thank you, Minister and Dr. Crisp. So let's start with the lost ID, and you know your ID number. The system will accept an affidavit. So if you go to the police station and you have an affidavit around your ID number, you can bring that as a part of the verification in making sure that we correctly capture your information onto the EVDS. So yeah, we accept a affidavit if you have lost your ID. Also, we recommend that you try and get a temporary ID document, or the temporary ID document that Home Affairs issue, because it will also assist you in terms of other transactions and processes in the country. But if that's not possible, an affidavit is also accepted. With regards to undocumented citizens, because it's a fairly new field for us, and the system is built on working with an identifier. We have got a technology solution. We, however, had to pilot it to make sure that the assumptions that we made is actually working in the real world. We did 3 pilots, or there's 3 pilots currently running. One is in eThekwini and KZN, and one is in the city of Cape Town, in the Western Cape, and one is in the city of Tshwane, here in Gauteng. And then over the next 2 weeks, we're going to scale this up and to start to work with at least one site where there is a high concentration, or maybe they've identified where there is a number of undocumented citizens. So we're going to look at one district in each province and scale it up systematically as we move forward, so that we can accommodate the undocumented citizens. There's quite a number of operational processes that we need to define, and this is why we are using a staggered approach for implementation. Thank you.
Thanks, Milani. Thanks, Honorable Minister and Dr. Nicholas Crisp, our acting DG. Before I hand over to the Honorable Deputy Minister, Dr. Sibongiseni Dhlomo, to do the wrap up, I want to check with the Minister if you don't have the parting shot. Minister?
Well, thank you very much, Foster. Thank you. Indeed, we again just want to say to South Africans that this is a very good opportunity. While the infection rates are still low, we have a window in a lifetime where we could reclaim a lot of lost opportunity. While the infection rates are low, we urge all South Africans who have not yet vaccinated to come forward, because if we do so, indeed, in the next few months, a lot of the things which that various people have been asking here, we can reclaim our lives back, both in the economic side, but also in the social and family activities. With that, I want to hand to Deputy Minister Dhlomo to do the wrap up. Thank you very much, Foster.
Oh, thank you very much, Minister. Good morning to the Minister, Mr. Foster, and our acting DG and all the colleagues. Maybe, Minister, to remember this very important media brief is to really record it in our department as a Kimberley media briefing, because we have come up with a very significant announcements that you have made today. Maybe it would be a good starting point, Minister, just to emphasize on what you said, to say the government has continuously never given any plans to actually have a vaccination that is mandatory. Now, we would want to actually request those South Africans, even whether they are marching or whatever, calling for no mandatory vaccination, to say that is not the policy of government of now. And therefore, just whisper to them when you see them in marches that the government is not planning. There's no plan of government to have that. And this is something very important. There was a very important statistics, Minister, that you announced to say, while we are really going down on infections, new infections, hospitalizations, but of course, there's still about over 5,000 South Africans who are in hospitals, various hospitals in the country being looked after by healthcare workers. We thank them for that. Maybe that is another reason that, yes, one of the additional reasons why the we may not be considering a booster vaccine for all South Africans, but our healthcare workers are the frontline soldiers facing this pandemic, even if we are getting it more decreased. And yet, we probably would say those 5,000 patients are still being looked after by them. So we thank them for that, and maybe your consideration to look into that booster for them is that significant. Minister, I'm sure some of the people might have forgotten that last week you announced that we are sitting at 33.1% population of the adult population vaccinated. And today you announced that we are at 34.6. I can actually, without any fear of contradicting myself, say next week you'd really be sitting over this mark of 35%. So that is very encouraging to see the progress that we are really making as a country in this regard. And therefore, we also are thanking the department in partnership with the Minister of Sport, Arts and Culture for keeping the promise that if you vaccinate, people will then be considered.
Right, we've got to quickly say goodbye. We'll take you back there to the briefing from the Health Department. A lot of things announced today. So I'm sure SABC News will give you a briefing as to exactly what went down with a summary.
Indeed. Beautiful days, beautiful weather in store. Take care. There's Weekend Morning Live with Simpiwe Ngongwane. Please tune in. We'll see you again on Monday. Take care.
Agenda up next. Bye-bye, everyone.